If you're early on in your pregnancy and having cramps, that can be really scary. So today we're going to talk about when it's normal and not a concern, and when it is a concern and what to do about it. Hi, I'm Rachel Moises, a mother of 8 from the Mighty Mama movement.
And I'm Heather, a family nurse practitioner and midwife.
So Heather, what does it mean if you're having cramps and you're in the, let's say, first, second trimester of your pregnancy?
Okay, well, cramps can happen for many reasons. First off, the uterus really only feels one sensation, and unfortunately that's pain. So if it's a stretching sensation, it feels pain. If it's a contraction, it is pain. Think of your period cramps, right?
And it interprets anything that happens as pain.
Right. It doesn't
Isn't
feel
that lovely?
I know. It doesn't feel hot. It doesn't feel cold. It doesn't feel tickles. It just feels pain or pressure.
Okay.
So then that's what our whole course is helping to feel pressure rather than pain. But it can be kind of scary. So first off, there are 4 ligaments that attach to the uterus. 2 of them attach in the front, kind of in the symphysis pubis area, your pubic bone there, and then 2 in the back to your sacrum. And those, as the uterus grows, those keep the uterus balanced and help it to not twist. That's one reason it's important to go to the chiropractor, because if your pelvis gets twisted, it'll pull those ligaments and twist the uterus and can cause a breech baby or a lot of back pain and stuff like that. So one common thing that happens is women will feel a lot of pain on their left or right side, and it can be mistaken for appendicitis because they're like, oh, I have this pain right here. And most of the time, it's just that ligament that's attaching to the symphysis pubis bone and going up to the uterus. And it's kind of being pulled maybe because your pelvis is out of alignment, or baby might say, hey, I'm going to sit on this side of the uterus today and cause mom discomfort.
Yeah. So the pain is, I don't know, unique enough, sharp enough. It feels concerning. Right. I think if you don't know what it is.
It really does. And then in the early, like around 12 weeks for a lot of women, ballpark in there, the uterus starts to come out of the pelvis and stretch because, of course, the baby is growing. The placenta, the amniotic fluid, everything is growing. And that stretching can feel like cramps. And that women think, oh my goodness, am I going to miscarry? One of the different way you can tell the difference is contractions are rhythmic. They come, they go, they come, they go in a rather rhythmic pattern. Even whether you're in labor or whether you're having warm-up contractions or you're having a miscarriage, where the round ligament pain and that stretching and growing pain don't come in waves. They just are there, and they're usually there for quite a while, and then they may subside, and quite a while, they may be there for 5, 10, 15, 20 minutes, not 30 seconds on, 30 seconds, not that wave pattern.
Okay, Mom, a quick mom-to-mom moment. I have to tell you this because I wish someone had told me. As you may know, I'm a mama of 8, and my first 3 births were rough. I just thought birth was supposed to be that painful. Nobody ever pulled me aside and said, hey, there's actually a better way. Then with my 4th baby, Heather, the midwife and nurse practitioner here, taught me something completely different, a method I had never seen in any book or video or internet research. And I ended up dialing to 10 centimeters with 0 pain. After 8 babies, I can honestly tell you this method works. Most mamas just never learn these strategies. Even if they want to avoid an epidural, they feel like they will cave once things get intense. That was totally me. I had done so much research, but I never found a real method that made birth actually manageable. And that's why Heather and I started teaching this, because birth does not have to feel like torture. So here's your little insider tip. We put together a totally free class for you. It teaches the most effective technique to reduce contraction pain and gives you a sneak peek of our full 10-step practically pain-free birth method. If there's even a tiny part of you that hopes birth could be easier, click the link below and grab your spot. Seriously, you'll be so glad you did.
So that's one way you can tell the difference.
Okay, that makes sense. So if it feels kind of like period cramping,
right,
that's just kind of there and sticks around, that's a little bit less concerning.
Right.
than if you were feeling like I'm having pain for a few minutes and then it goes and it comes back, and like this sort of pattern like you would expect if you were in labor.
Exactly. And then another big thing is bleeding. Are you having any bleeding? That is a key factor. And bleeding can be very scary as well.
Mm-hmm.
There is something called a subchorionic hemorrhage. I think we've talked about it before. And with subchorionic hemorrhages, there is rarely, if ever, cramping. You don't have cramping. All of a sudden, you're just bleeding.
Mm-hmm.
And it's usually a decent amount, like more than toilet paper, more than just a little panty liner.
Uh-huh.
And that seems really scary because you're like, oh my goodness, this seems like so much blood.
Right.
Am I miscarrying? But you won't be feeling any cramping. And typically with miscarriage, you're going to feel cramping and bleeding together. But with like a subchorionic hemorrhage or implantation bleeding, you'll just have some bleeding but no cramping.
Okay.
Is most
so
common.
I'm assuming that is something you still want to go get checked and make sure.
Oh yeah.
What is it? If you
right.
have
any bleeding, you should get it checked out.
Okay.
Yeah. But it's not as, because you'll be wondering like, what is happening?
But you're
here?
hoping that that's what's happening.
Right. Exactly. Not a miscarriage.
Okay.
Exactly. Yeah. And so, but if you're not having any bleeding and you're just having random cramping, it's not as concerning. If it gets quite severe, of course, go and get it checked out.
Mm-hmm.
Make sure. Now, one thing is, remember, your appendix is in your lower right quadrant of your abdomen, right? But as the uterus grows, it displaces your intestines and all of your internal organs a bit. Everything gets very, very squished. I'm sure you've seen the pictures of how everything's squished. So the appendix is actually, at a certain point, no longer in the lower right quadrant. The appendix can be all over.
It just kind of pushes everything out of the way.
And so when someone is, let's say, 30 weeks pregnant and they have that lower pain, it's most likely round ligament pain, not the appendix, because the appendix is
might not even
there.
Be there.
It's not there. Yeah. So once again, if it becomes very severe, if you have a fever, if you have nausea and vomiting with it, go get checked out.
Mm-hmm.
But if it's just this random pain that you feel, once a day, or, comes and goes, meaning not comes and goes rhythmically, but, it's here one day, it's not another, it's back and forth, it's probably round ligament pain. And in that way, no bleeding, of course. Chiropractor can help align your pelvis. That will take the torque off of your uterus and everything.
Mm-hmm.
And usually that round ligament pain will disappear.
Okay. And obviously you can go get checked anytime that you're worried or concerned.
Right.
We're just trying to help you navigate how concerned should you be. And also if your doctor has explained any of this to you, but you didn't quite understand, now we're helping you understand. Right.
Because it's nice not to spend hours sitting in the emergency room and for them to say, it's round ligament pain.
Yeah.
Or it's just your uterus growing. And then you have, a huge medical bill now and everything. So hopefully this will help you decipher between something that's urgent and something that is just normal. I call them the joys of pregnancy.
So another question I have is, so we talked about early pregnancy cramping. Can you get that kind of cramping at any point in pregnancy? Like, is that normal to expect later on as well?
Well, it depends. Yes and no. Typically in the middle of your pregnancy, you won't feel that much. Kind of, let's say from like 12 to 16 weeks through, 30, 32 weeks, you really shouldn't feel any cramping. That's where you need to be aware of preterm labor and going into, having a baby too early. Now, once you hit about 30, 32 weeks, and depending how many babies you've had, because a first-time mom doesn't always feel what they warm-up labor contractions, what they call Braxton Hicks. Mm-hmm. They don't always feel that. Where the more children you have, it's like your uterus has to work a little harder, because it's getting a little more stretched out. And you'll feel those earlier and earlier. So I remember by my third baby, I was feeling Braxton Hicks by like 24 weeks, but they were very mild, annoying, contractions that would just kind of come and go. Where my first pregnancy, the only time I felt those is if I threw up. So
and that would trigger
the contractions, and they would only last 5 minutes
right.
after, kind of thing. But yeah, if you're having rhythmic contractions, at 20 weeks, 24 weeks, 26 weeks, go get seen right away. Because remember, the cervix doesn't have to dilate to a 10.
Mm-hmm.
It only has to dilate as big as that little baby is.
Oh, okay.
So you don't have as much time to stop that labor at the hospital. So once again, that doesn't mean, you run to the hospital with every contraction, but if you notice that rhythmic pattern, and okay, this has been going on for an hour, because Braxton Hicks typically will happen, well, I would say maybe half an hour at most. Or they're so sporadic.
Just really random.
Yeah, just really random.
Or when you already have children and they push on your belly, sit on your belly, squish up against your belly, always gives me Braxton Hicks.
Yeah. Like for me, by my fourth baby, I had what's called an irritable uterus. It just contracted all the time. It was very annoying.
Oh, how fun.
I know. So I would, let's say I'm making spaghetti for my kids for dinner. I would get everything prepped, get the water on to boil, and have to go sit down. And then I would have to wait for the water to boil. Once it boiled, I would get up, put the spaghetti in and put the sauce, getting it started and stuff. And then I'd have to go sit down because I would be having so many contractions, not contractions that would dilate me, but just annoying and uncomfortable, kind of that cramping. Yeah. And then I would, come and drain the spaghetti. And I mean, dinner took a while to make because I had to constantly sit down.
Not easy to live your life when you can't stand up for very long.
Right.
For a lot of reasons.
But they didn't last very long. And it's not that I was worried about going into early labor. It's just that it was exhausting.
Yeah.
It was exhausting to have that. So one thing is too, the more you massage the uterus, the more it contracts, which is great when you're in labor, getting contractions going. But never go to a massage therapist and have them massage your uterus unless you plan on going into labor, because the massaging of the uterus can cause that cramping. And we don't want that to happen.
Okay.
So yeah. Also, another thing that can cause cramping is sex. Ina May Gaskin says what gets the baby in, gets the baby out, it's oxytocin. And so every time, like when you have nipple stimulation, when you have an orgasm, that is oxytocin, and that can cause contractions. Is it going to put you into labor? It might if you're 38 weeks pregnant, but if you're 28 weeks pregnant, it's just going to cause some cramping. No reason to be concerned unless that cramping continues and continues.
Okay. So that's our theme. Cramping that's kind of annoying, uncomfortable, a little painful, versus rhythmic, regular, what we can call contractions.
Right.
Even though when they're early on in labor, I don't know if it technically is, but maybe.
Yeah. And it's just knowing what's normal and what's not.
Yeah.
Pregnancy comes with a lot of weird stuff, I guess you could say. And every woman is different. And so finding out what's normal for you, and that will change from every pregnancy. But I remember my first pregnancy feeling these cramps at I was probably 11 weeks pregnant. I was in the store shopping with my mom, and I remember these cramps and thinking, oh my goodness, but it wasn't rhythmic. It was just those solid period-like cramps. And most likely it was my uterus growing and extending.
Okay, so we mentioned miscarriages. How about as a potential reason for cramping and when to be concerned about that? How about ectopic pregnancies? Can you explain what that is and why it could be related to cramping?
So ectopic pregnancies will typically, because nothing's 100%.
Right.
Will typically be just a little to the left or a little to the right. And that is when a pregnancy, instead of happening in the uterus, is happening in the fallopian tubes. And that is stretching the fallopian tubes, which is why it's usually a little to the left or a little to the right. It wouldn't be like way over here. It'd be just off center. And the fallopian tubes are expanding. Well, they can't expand very far. And so they would rupture, which can be life-threatening to the woman. And so typically with an ectopic pregnancy, the pain is going to be sharp. It's not usually a dull ache. It becomes very, very sharp. It can be confused with appendicitis if it's on the same side and it will make a lot of women nauseous. And those you need to act on right away. And this is a pain that doesn't go away. It just gets worse and worse and worse and worse. And it typically happens around 6 weeks.
So sometimes you won't even know you're pregnant yet.
Right. So it's
a lot of times
it's not going to happen in a 12-weeker.
Right.
Like absolutely not. This would be like 6 weeks, 7 weeks, very, very early, when the egg should have traveled to the uterus, but it got stuck in the fallopian tube. And those need to be taken care of right away. The quicker you can take care of those, you can save the fallopian tube. If it goes on for too long, then they do have to take the fallopian tube. So important thing to
be aware of.
That more sharper, more intense pain. Yeah.
Okay. And then the last thing we want to cover is if you are having the cramping, that's not the super concerning kind, what can you do to just deal with it a little bit better, help ease it,
right,
or manage it, I guess?
If it happened, let's say, while you were exercising, then I would stop exercising, okay? If it happens while you're hiking, stop hiking. But warm compresses, not hot compresses, but warm compresses can help. I wouldn't take any medication, painkiller, things that way. It shouldn't be that intense. In our program, we talk about anti-cramp tincture. We use the one from Sunstone Formulas, but there are a bunch of different ones out there. And you can take those, and those can help a lot of times kind of ease that cramping.
Tastes really bad.
Oh yeah,
I'll tell you.
but just you chase it down with something.
Yeah. If you can get it down, it'll help you feel better.
Yep. And you can take that. So I give that to a lot of my moms that are just having those really irritable cramps that are not dangerous. They're just, this is irritating. Bothersome, yes. And then hydration is another one. Make sure you are hydrated, especially when you're more pregnant. You will get an irritable uterus a lot of times when you become dehydrated, because a really, really simple way to explain it is the little part of your brain that says I'm thirsty is right next to the little part of your brain that says I'm going to go into labor. And so when the body puts out chemicals saying, hey, I'm thirsty, I'm getting dehydrated, I need you to drink, those chemicals can kind of cross and hit the part, and the body goes, I need to go into labor. And you're like, no, I'm just really, really thirsty. And the body goes, okay, I'm going to go into labor now. And so the way to calm that down, one of the biggest things that we do to stop an irritable uterus, or kind of, I don't want to call it preterm labor, but a woman who is having a lot of contractions, is we give them an IV fluid, and that stops the contractions and they go home. And that's because it stops those hormone chemicals from getting mixed up in the brain.
Okay.
And so I had one mom that she had this very irritable uterus. I mean, just contracted all the time. She'd had, I think we were on her 6th baby. And finally I was like, you know what? I'm going to give you an IV. She's like, no, I'm really, really hydrated. I'm hydrated. I'm like, I know. But I'm going to give you an IV because it's the perfect electrolyte balance. You know, it's not just water, it's the electrolytes and the whole thing. And I gave her an IV, and she was happy as could be for like 2 or 3 weeks with this calm uterus. And that can really make a difference.
Oh, that's good to know.
Looking at your urine when that happens, because we have a lot of women that come in and they say, I'm having all these contractions. And we're like, are you hydrated? They say yes. We're like, okay, go give us a urine sample to make sure it's not a bladder infection, because a bladder infection can also cause a lot of pain. So we'll talk about that in a minute. So they will go, pee in a cup, and it'll come out like yellow, orange. And we're like, okay, this needs to be much clearer.
Right.
You're
not hydrated.
Right, you're not hydrated. So, and once again, it's not just water, it's electrolytes as well. Coconut water, and there's a lot of good drinks now that don't have the dyes and sugar and artificial sweetener stuff that are good electrolytes that you can do. But a bladder infection. So a bladder infection can feel like really bad cramping. And that can be confusing. They're like, I have this really bad cramping. So make sure it's not a bladder infection, because you will feel that more when you're pregnant, and you're more prone to bladder infections than when you're not pregnant. And so getting your urine tested and making sure, obviously, if you're peeing razor blades, if you're having that. And as it gets more severe, it can also spread to back pain, the lower back pain there. And if it turns into a kidney infection, it's going to go up your back and give you a different back pain, and you're going to have the cramping here. So that's something that can happen. And it's very common to have that where someone gets reoccurrent bladder infections and they feel it as cramping.
Okay. That's good to know.
Get that checked out too. If it's not just, the occasional, but you're like, this is like,
it's persisting.
Yeah, this is really, happening, then go get tested for a bladder infection.
Okay. All right. There you have it. Everything you need to know about cramping while you are pregnant. And don't forget that we do have a free birth class called How to Give Birth with Practically No Pain. So if you're interested in having a low pain, calm, safe birth, be sure to check that out. There's a link below.